Tonight's program is Sleep Smart for a Better Tomorrow. We're going to be talking about sleep and what we can do to sleep as well as possible. And this is a topic that comes up quite a bit because fatigue comes up quite a bit, and sleep problems are very common for people living with MS. So we're going to explore better sleep routines and how they can support emotional wellness and physical health, and especially for us that are living with MS. So I am so happy to be here. I'm very happy and thankful for Beatrice for their sponsorship. They've been sponsoring, Beatrice has been sponsoring the MS Mental Wellness Chat for a good while now. So I always like to say thank you to Beatrice for their sponsorship, and also thank you to MS Views the News for bringing this program to the MS community. We have been in a heat wave, so people may have had a little bit more fatigue, a little bit more emotional liability if they don't feel good from their fatigue. But today we're going to talk about sleep, and I'm going to add in Nancy has 29 years with MS. So Nancy, thank you so much for sharing. Before we get into sleep, I just wanted to start with a positive. What is a small win for you today? So thinking about something that was a small win for you. It doesn't have to be big. Actually, I prefer it to be kind of small. So for example, my small win is that I was able to make a iced coffee before this program. So it's just a small win. It's just a little thing. And I saw that I have a rose blooming in the garden. So I'm excited about that. So we have Amelia from Boaz, Alabama. I'm happy to be here. She's sad tonight because her sister-in-law went to the hospital today. Thank you, Amelia, for sharing that. We'll be thinking about you and your sister-in-law. Melissa from Destin, Florida. She's had MS for 16 years. Kenneth asked me, you've been doing this for years. When is my book coming out for all my tips? I have no plans on writing a book. I just hope to share them all this way. But who knows? We never know, right? Jane says, Jane from Kansas, sorry, 47 years with MS. Is there anyone any longer? 47 is a lot of years. So anyone, if they're longer than that, let us know. Jim says, took myself, these are small wins for today. Jim said, took myself via chair to have blood drawn. Very good. Nancy said 1 hour at the gym. Lisa said, I did the laundry. Joe said, I threaded a needle. That is a big deal. I've been sewing lately, so I can understand that. Julie said, this program. Thank you, Julie. Tina said, my breakfast was a small win. I made steel cut oats and topped them with strawberries, blueberries, banana, raw pecans, and maple syrup. Heart and MS friendly. Very good. So think about your small wins as we go on. It's important to think about these small things because these small things make a big difference. And if we can pay attention to them and notice them, they make our day much, much better. So, so we're going to move on to our next slide, and we're going to just talk a little bit about what we're going to be talking about. We'll move forward. We're going to really stick with a couple of themes. We're going to talk about understanding how sleep kind of affects our brain and our mood. We're going to talk about creating healthy sleep routines, and then also using relaxation and self-care to help, tools that make a difference. So whether you have trouble falling asleep, staying asleep, or just feeling rested, parts of this will be for you. And this is not perfect because sleep issues are a big deal. So I'm hoping by the end of this today, you're going to have like a better understanding of sleep and MS, and maybe some inspiration to kind of start to think about what are some things that you can do to build a healthy sleep routine. So why does sleep matter with MS? We'll move on to our next slide. Sleep is not just rest, it's repair. And people with MS are more likely to experience poor sleep due to symptoms like spasticity, pain, fatigue. bladder incontinence, or urgency, and other symptoms. So good sleep is supports our immune system, our brain function, and I can hardly speak today, our emotional resilience. And all of these things are very, very critical with managing MS. And there are a lot of common sleep challenges with MS. We'll move on to the next slide. So let's look at some common ones. There can be pain and neuropathy. We just need to move forward one slide though. Nighttime muscle spasms, frequent urination, anxiety or depression. And many people can also experience MS fatigue, which complicates daytime and nighttime energy levels. And so, and that's something I deal with, I know. And so, if you sleep too much or rest too much in the day, it can affect your evening, etc. So, so really, in essence, sleep is critical to mental clarity, to emotional regulation, and to our health. We're going to pause for a minute. I'm going to read a couple more wins. Allison says, my chiropractor helped relieve pain in my lower back. That's a big win. I'm glad you're feeling better. Dion says, I was able to stay in the house and stay cool. That is really good. And then we have Tammy here from McDonough, Georgia. I'm so glad we have a lot of Georgia people here today. So happy to hear that. So, so as you can see here, that MS has a lot of presents a lot of issues for sleeping challenges. Just to begin with, there might be sleep apnea, insomnia, depression, anxiety, the frequent urination that I talked about, restless legs, pain, spasticity. We'll move forward with our next slide. And poor sleep greatly affects our mental wellness. So sleep and mental health are deeply, deeply connected. And so poor sleep can make you more anxious, can make you feel more depressed, more irritable, and can be a cause of cognitive fatigue or cognitive fog, as they would call it. So, and it's not just about feeling tired here. Sleep deprivation can impact your entire quality of life. So, I want us to think about for a moment. Let's think about our current sleep routine. Drop a word if you can, or a phrase in the chat to tell me kind of like, how is your sleep routine? Or how is your current sleep routine? So, and then we'll answer the chat box next. But like, let's think about how our sleep routine is. So, Tina says inconsistent. I will say, Katrina says same time, good. That's awesome. I'll say that my sleep routine is pretty consistent unless I'm stressed. Dion says miserable. I'm glad you're here. Kevin says night owl, and that's okay. I'm married to a night owl. Aubrey says challenging. Latoya says inconsistent and poor at times. And so you can continue to answer, but I also want you to think about, how has poor sleep affected your mental wellness? So if you had Anne says too many pets, welcome to the program, Anne. So if you've had poor sleep, how does it affect how you feel emotionally? And I'll get us started. I am so grumpy. I'm in a bad mood and I'm not fun to be around. And my husband probably could testify to this. Like, I'm just like, I just don't, I'm just not as fun as I normally am. So Terry says her sleep's erratic. Lisa says, I sleep 2 to 3 hours at a time, so atrophy doesn't set in. And she's also nocturnal, so later at night. Jane says poor, trying to get everything done and then try to go to sleep, and it doesn't work. Rick says good for about 15 minutes before bedtime and then shut everything off and sit and relax and go to bed. So that's what he does. Good. Katrina said that she's short with people, she doesn't have enough sleep. Kevin said he can sleep from midnight till noon. Julie says, good when my catheter is working. Latoya says, I feel anxious and down. So we'll talk a little bit about that because that can, your mental health is immediately impacted. Joe says, feels drained. Dion says, feel blah, irritable. Antoinette says, cognitive fog is a problem the next morning due to poor sleep hygiene. And Aubrey says, I struggle with depression and cry often when I don't get my rest. Tina says, I wake up agitated and emotionally overwhelmed from poor sleep. Nancy says, good sleep, meditation once she's in bed. Allison says, I'm a night owl, but my bedtime is all over the place. My pain is always worse. So we can see that sometimes there's a connection when we don't get enough sleep that we don't feel as good either physically or we don't feel as good emotionally. And so we're going to move on to our next slide, and we're going to talk a little bit about breaking the cycle of bad sleep. So we'll move to our next slide. And we're gonna talk about how do we do this. So when we're exhausted, we may nap too long or rely on caffeine or screens late at night. And these quick fixes really can backfire on us. And then breaking the cycle officially means that we're identifying patterns that keep us stuck in poor sleep and gently, so I want you to hear this, gently replacing them with healthier habits. Because when we do small changes done consistently, this can create powerful shifts. Now, I'm going to share something with you that I think is helpful. So I had got myself in a bad habit of snacking late at night. So I would fall asleep because I'd be so tired. And then I would wake up hungry. And so I for a good bit of time I was doing this. Like, it was a horrible habit for my diet, for my body, for a lot of things, but it was sort of just a pattern that I'd got myself into. So this is something that I worked in a very gentle way, that I'm working in a small way, and I've been able to switch this up with different habits, but it was hard to do. And I think that sometimes when we have really quick things that we want to change, it becomes really hard. But if we're gentle and we do make small changes, they can make bigger differences. So David says, I nap a lot during the day. Amelia says, if I don't get sleep, I can't wake up well enough to go out in the mornings. There's definitely that connection for many people. And Katie says, I watch TV late until falling asleep around 2 a.m. and waking up at 10ish. I'm retired and sleep, but it makes the start of my day late, which can kind of impact your mood. So today we're going to talk a little bit about breaking some of the cycles and kind of recognizing some of the things that we're doing. I'm not saying that anything that you're doing is wrong or bad. I just, I think it's good when we can look at kind of what our patterns are and what we are doing to see, is there something I could change? Like a while back, I realized waking up every night or almost every night to eat is probably not a good sleep routine. And I need to fix that because that was becoming a bad habit. So we'll move on to our next slide here. And so I want you to think about for yourself, so we don't need to do this in the chat, but think about your own assessment. How is your sleep? How long does it take you to fall asleep? How often do you wake up during the night? And when you wake up, do you feel rested? So just keep kind of like a mental note of this, or if you had a piece of paper, you could jot it down. And remember, these recordings are always, all these presentations are always recorded, so you can access this later too. Self-awareness is the beginning of all of this. So if we can be aware of some of our sleep patterns, aware of some of our habits, then we can start shaping a plan for self-care. So we're going to move on to our next slide. And I want to ask you, because there's probably times in your life, even including now, so if you're sleeping well now, like I have been, I want to ask you, what has worked for you in the past? Um, if we can figure out kind of what has worked for you, then this will help. And if you have something that you haven't been able to figure out what works for you, what's been a barrier for you? Dion says, I'm trying to have my husband help break some of the destructive patterns. So it is helpful when you have a support partner as well. I know for me, what's worked in the past is when I have a sleep routine and when I have some time by myself. And I'm not going from being fully awake to trying to go to bed, that I have like a wind down time. That has worked for me in the past. And then a barrier to sleep was the eating. So making sure I'm eating enough before I go to bed and making sure I'm going to bed when I'm ready to sort of wind down. So we don't have we have. So Tina says, Jason Stevenson sleep meditations on YouTube have worked for me in the past. He has a lovely Australian accent and puts her right to sleep. And then Aubrey says, I have both narcolepsy and cataplexy and sleep apnea. So this is very complicated. So it's very hard because she can't take some of the gabapentin before she takes her narcolepsy medicines. But and then having to manage, so some people are having to manage pain, sleep issues, and she said, what do I do? Now, I can't give medical advice on here, but I say definitely talk to your doctor, talk to a sleep doctor, especially because you're able to identify that some things are waking you up as well. So, and that is, you are beautifully complicated and complex in that example, but that doesn't mean that it's not doable. It means that maybe talking and working with your healthcare provider and your team to figure out what the right recipe is for you, if that makes sense. But you can still do some of the things to support good sleep. Kanita says, I concentrate on listening to my environment, both near and far. John says, the barrier is when I don't have free time until it's late, so no wind down time. That can be really tough. Amelia says, I don't scroll. She doesn't scroll on her phone before sleeping. I think that's a great idea. From Nora, she says, listen to Amen bedtime story meditation after praying. I fall asleep before the end of the story. And then Jane said, would you please repeat where we can hear Jason Stevenson? Absolutely. Jason Stevenson has sleep meditations on YouTube. And apparently he has an Australian accent. So that's, he's on YouTube. I would also recommend the Calm app if you have access to, Anne has just mentioned that as well. The Calm app. The Calm app has some really good sleep stories and some meditations that are helpful. Vera says, breathing exercises and meditation works for me. Anne says, I needed a paradigm shift. I took steps to move out from having any roommates. It was a huge effort, scary, unsupported by most, but now I feel like I've reclaimed my life. And so she's in control of things like her thermostat, which thermostats are really important for sleep. Julie says, my husband empties my bag so I can go to sleep. That is amazing. Lisa says, I always try to set myself for success. No worries on my brain when I'm going to have a bad day. I know I have my family for support. Allison said, when I worked, I had a normal routine. I don't have anything to look forward to each day now, and that's definitely affecting me. So when we don't have as much of a routine because of work, and it's really hard to switch, if we, one of the things that we can do is try to have a light routine and try to create a new routine. It might not be as rigid as your routine would be for work, but it could be very helpful and very beneficial to kind of keep you sort of on track for your day. And that will help to get you sort of in some habits and some routines. Dion said the Calm app has some music that you can listen to that will help with sleep. Aubrey says sometimes I listen to ASMR sounds and that can help me fall asleep. And Amelia said, did someone say amen meditations? I believe so. Um, and then Tina says it helps to cool down the bedroom. You guys have a lot of insight here. So we're going to move on to our next slide. And I love this because this is how we help each other, is that we share. Kanita says, I make my environment completely dark. And then Tina shared jasonstevenson.net. So if we can move the slide, please, to the next one. Okay, so we're going to talk a little bit about establishing a sleep routine. So our bodies love and crave rhythm, and a consistent bedtime and wake time, even on the weekends, can support having a natural sleep cycle. It's important to have a wind down, like anywhere from 30 minutes to 60 minutes before bed, with calming rituals. So you might be reading, you might be listening to meditation, might do gentle stretches, might have like chamomile tea, or sometimes in the winter I'll take a warm bath, like that will help me get kind of sleepy. But kind of creating kind of a routine where you can kind of walk through the motions of what bedtime looks to you, because your body will start to pick up on those. And avoid trying to force yourself to sleep. You kind of essentially create the conditions and then let kind of rest sort of come to you instead of you trying to chase the rest. Dimming lights, having a dark room is helpful. Having a cool temperature room can be helpful. A sleep mask, I brought these two from my bedroom. I have one that's like a serious one that like blocks out everything, and then I have kind of like a different one, but I have them both in my room. Those learning how to block out some of the light can really help you. There's something called like light pollution, I believe, and it's not really pollution. It's just keeping you from being able to sleep. Having a fan, I even so here's a fan I use to sleep sometimes at night, and I travel with that fan actually. And then even this little, I turn off all the lights in the room, and then I just have this little lamp that I set on the bed while I'm reading a book, and kind of getting the room sort of dark and ready. And Dion says I sleep with a mask with a Bluetooth speaker, so you could do meditation. That is great. Another part of sleep routine is limiting naps to earlier in the day. I'll be honest, this recommendation is to 20 to 30 minutes. I can take, I would say during the work week, that's pretty fair for me, but on the weekends it will be an hour nap at least. But setting my alarm as well. But thinking about what is your routine. So we'll move on to our next slide. And let's think about what our sleep environment is like. So people generally sleep better in a cool, dark, quiet room. Some of you may benefit from, I have a noise machine, almost like when you go to the doctor's office or if you've had a baby, a white noise machine. I have that outside of my bedroom and one inside my bedroom. That can help. Having comfortable mattresses and pillows, making sure that you're comfortable. So this one is a little bit controversial here, and so I want to be realistic. So it says no electronics in the bed. That seems pretty severe, especially where we are in this world right now with electronics. If you must use, go back to the, if you must go back to using, electronics, there's settings that you can change the warmth of the light. Thinking about, how much are you using electronics before bed? Can you reduce that by a little bit? Could you change the light a little bit? Are you using electronics to listen to sleep meditations or to hear sleep stories? Or are you using it to kind of scroll on social media, which might create a lot of thought? And are you reading a book? Are you what are you doing and what is it causing? It's just something to personally think about. And then also for your sleep environment, weighted blankets for anxiety might be helpful. During COVID, I got everyone in my family a weighted blanket, and it was helpful. We generally don't use them now, and my dog Charlie kind of, I think, kind of almost steps up as a weighted blanket because he lays on my feet a lot of times. But weighted blankets can be helpful. So we'll move on to our next slide. So now we're going to talk a little bit about nutrition and sleep because all these things have something to do with it. What and when we eat can affect our sleep. So heavy meals kind of close to bedtime can really cause discomfort. But if you're doing like I was doing and not eating enough at dinner and then waiting until bedtime, then you might wake up hungry like I was waking up. So that was no good either. So knowing that caffeine, we can be very sensitive to caffeine. Some of us more than others. I'm not so much, but some people can be. So caffeine, can stay in your system from 6 to 8 hours. So watch, like kind of your caffeine intake. Know what works for you. Know what doesn't work for you. Considering having a protein-rich snack, which is the thing I do now before I go to bed instead of waking up hungry. Considering limiting alcohol. And the reason you think alcohol makes you drowsy and will help you sleep, but the truth is that even if you fall asleep fast, chances are if you have drank alcohol, you probably won't sleep the whole night through. You might have disrupted sleep, etc. It's not quite the nightcap that many people will say it is. And then considering foods that are rich in magnesium, because magnesium promotes good sleep, and you can, I am not giving medical advice. You could talk to your medical provider about, a magnesium supplement, which is also good for digestion and good for other things. So, but magnesium supports good sleep. So we have Tina who says that for chamomile tea, she drinks celestial seasoning, sleepy time, caffeine-free herb tea. And that is helpful. And then Jane says, I listen to lullabies on Amazon. Can set a time on a timer on so it turns off by itself, which can be helpful. That is awesome. So we'll move on to the next slide. And we're going to talk about exercise and sleep because there's a relationship here too. So physical exercise and activity can promote a deeper sleep. So we have to generally aim to finish workouts or significant workouts at least 2 to 3 hours before bed because our heart rate is going to be up. We're going to be worked up high, kind of more alert. And for those with MS, even light stretching, chair yoga, or short walks can help. So I would like for you to introduce the idea of exercise can look different as we are as individuals. I think about even that movement doesn't have to be intense to be effective. I've been, walking a good bit with my husband, but the weather is impacting how that feels to walk outside. And so we changed walking to kind of shopping in some stores, but I still got, the movement in that I wanted to get in, and it just looked a little bit different, so we could be in the air conditioning. So just knowing that low impact things are equally as good. It's finding the right exercise and what works for you. So we'll move on to our next slide, and we're going to talk about some tips for napping. How many good nappers do I have on here? I'm going to raise my hand. I'm an excellent napper. I can fall asleep very fast. I have to set an alarm or it's Russian roulette. I do not know when I will wake up. It could be 30 minutes or it could be a couple hours. So do we have good nappers in here, people that can fall asleep very easily? And we'll move on to our next slide. So, okay, David says me, thank you. I thought it was only me for a while. I'm kidding, I knew that we would have good nappers here. Vera says, I love a good nap. Jane says, I can't nap. I envy people who can. Tina said, I am not a napper. So we're a little bit split here. And then John says, I nap better than I sleep, which that is true for some people. And then Allison says, I usually don't nap. So napping can be a helpful tool but it also can be an enemy. So we have to use naps wisely. Dion says, I nap as needed. So here's some of the napping tips. Keeping naps short, to like 20, 30 minutes. I said on the weekends, an hour for me. I'm okay with that. I usually generally on the weekends need a little bit longer of naps. It's best in the early afternoon to nap instead of later in the day. And the reason why is that you don't want to have I'm sure that even our good nappers here have had naps that have messed up their bedtime before. And thinking of naps as sort of like a booster, but not a replacement for your nighttime sleep. Thinking about, tools like setting a timer, that can really help because some people can nap and fall into a deep sleep and maybe miss out on activities like my teenage son did recently, or like me, where I could sleep, a lot longer than I'm intending to do. So Tina says, how long is too long with napping? I think it's, it can really depend on people, but I think a good nap is when you're able to wake up and you feel a little bit rested and refreshed. A bad nap is when you feel so tired because you were sleeping so heavy. So I'm sure a sleep specialist, and again, I'm not a medical doctor, I'm a licensed clinical social worker, a therapist, but within your circadian rhythm, I would bet between your 20, 30 minutes, it's going to avoid you from going into a deep, 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 deep sleep. And then Katrina says, I don't like to nap, but sometimes I fall asleep unintentionally in the afternoon. And Julie says, I'll be watching TV and sleeping also. I always think football is my best napping channel on ever. Okay. So let's talk about the role of stress here, because goodness gracious, stress is a sleep sabotager. And it's probably one of our biggest barriers to or disruptors of sleep. And MS in itself offers like a lot of unique stressors. So when we're anxious, our nervous system stays activated, and this makes rest harder. So it's really important to listen and to recognize and respond to stress with calming tools that are essential to sleep. So if you're new to the MS Mental Wellness Chat, we've done a lot of programs that you can access on the MS Views and News YouTube channel on stress management. Stress is inevitable and it's going to be around us all the time. And sometimes it's positive stress and sometimes it's negative stress. We can't control some stress, we can control some, but often what we can control is our reaction to it. And so it's really important to make sure that we're doing those stress management behaviors, because that will help us with our sleeping. We're going to move on to our next slide. What is the biggest barrier to sleep for you? So I will start off with mine. I had two barriers. One, if I was hungry, it was a big barrier to not be able to sleep the whole night through. And the other one is stress. So if I'm watching stuff on the news or watching things that, really kind of hype me up, then that becomes a barrier to my sleep. So think about, what are your barriers to your sleep? Because if you know your barriers to sleeping well, then you're going to be able to address those barriers. And so we'll move on to our next slide, but I still want you to think about that. Tina says stress and ruminating. She's a night owl. Katrina says nerve pain and anxiety. When we can identify some of the barriers to our sleep, we can learn to address and provide techniques that can help them, and that possibly can help us to feel a little bit better. Okay, we're going to move on to our next slide, but we're going to keep talking about this as it comes up. Latoya says stress and drinking caffeine too late. See? So those are really good examples. So we're going to talk a little bit about relaxation techniques because they can be very beneficial tools to helping to aid a good sleep. And relaxation is a bridge to sleep. It signals to your nervous system to slow down, that you're okay, that you're safe. And we're going to talk through a couple of these options tonight. We're going to talk a little bit about deep breathing, visualization, progressive muscle relaxation, journaling, and knowing that these can be kind of all tailored to your style, and that some people prefer, you know, one where other people will prefer another one, and it is okay. It's about what works for you. So we have Rhonda who says bladder issues can be a barrier to sleep, and Joe says my leg shakes every 15 seconds. That a clear barrier to sleep. Thank you for sharing both of those. And so we're going to move on to our next slide, and we're going to talk a little bit about deep breathing. So I talk about deep breathing quite a bit. It's a good stress management tool. It's a good resetting tool, a good grounding tool, and it's a good tool to kind of help get you into a place of relaxation for sleep. And I also think it's a good tool if you're just feeling a little bit anxious. So with this kind of breathing, I always like to breathe in through your nose and out through your mouth. And an example of doing this would be to do this 5 times, but you breathe in for a count of 4, you hold for a count of 4, and then you exhale for a count of 6. So we're going to walk through, we're going to do 2 cycles of this. We don't have enough time to do all the cycles, but we will do 2 cycles of this. So we'll inhale for 2, 3, 4, hold for 2, 3, 4, exhale for 2, 3, 4, 5, 6. Inhale for 2, 3, 4, hold for 2, 3, 4, exhale for 2, 3, 4, 5, 6. So you would repeat that pattern at least 5 times, just focusing on your breathing. And this can help to relax you and to kind of put you in a mental state of relaxation and a physical state of relaxation that can help promote good sleep. And I love a lot of the sleep stories, which we'll talk about as more guided imagery, or the meditation breathing activities that a lot of the apps have can really help you with this. Now, if you're listening to something like a lullaby on Amazon, you can actually just do this breathing pattern as you're listening, and it can honestly lull you to sleep eventually. It could be helpful. So we will move on to the next slide, and we're going to talk a little bit about visualization. And so these are not one size fits all. So if you're wearing, you know, a sleep apnea mask, you might not be able to do, you know, some of that breathing activity in that same way. So maybe breathing or maybe focusing on a visualization exercise might be better, or maybe this is better because it's just better for you. So, so with the visualization, what you're doing is you're picturing a place where you feel completely safe and relaxed. It might be a cozy cabin, it might be in the mountains, it might be a beach, the forest, somewhere that that speaks to you. And then you imagine the sights, the sounds, the smells, allowing your mind to essentially go there. And visualization can help you shift your mind away from worry to rest. And it also helps to refocus because you can't be thinking about A, B, C, and D if you're thinking about all the senses of where you are thinking about is. So if I'm thinking about the mountains, thinking about how does it smell there? What does the air feel like? You know, what are the things I can see? That sort of thing. So we'll move to our next slide, and we'll talk about progressive muscle relaxation. So progressive muscle relaxation, actually, and these 3 things are the 3 of the favorite things I used to do and when I was a therapist full time. Now I work with oncology patients and do patient education. But when I was doing therapy, I would do these 3 activities often with people. Progressive muscle relaxation is one of my favorites, and it involves like tensing and tightening of muscles, and then you relax them by muscle group one by one, and it what it does is it releases a physical tension, which gives your body a sense of relaxation. So we're gonna practice this here. I've had us do it before, but we're gonna do it again because it's worth it. So I want you to clench your fist if you can. If you can't, I want you to tighten a different muscle, and you hold it tight. Let's hold it for 5, 4, 3, 2, 1, and then slowly release. And then what happens is that as you release, that gets your hand gets a sense of relaxation. You feel a sense of relaxation, and you notice a difference. So with progressive relaxation, you can find lots of these activities on YouTube, very accessible to find online. But you usually would start with like the top of your head and work all down through your body with the muscle groups. I like when somebody narrates to me on how to do it. It's a little bit easier to stay focused. But it can be a very relaxing activity. So much so that I always like to share. When I had very significant anxiety early on in my MS journey, progressive relaxation was really helpful for me, to the point where I got to where I could be like nervous and have my hand like under a table and doing just kind of that, like the tightness and release, or taking my calf muscle and making it tight and then releasing it. And I would be able to calm myself down when I'm feeling anxious. It's a very powerful tool. So we have Nancy said, Nancy, we're gonna cover that 1 second. Okay, so the next thing we're gonna talk about is journaling before bed. So we'll move on to the next slide, and we're gonna talk about really, writing to clear the mental clutter. So have a paper before you go to bed, write down whatever is on your mind. It's sort of like a brain dump list. And you can also think of it like, what do I want to release tonight? That's a good prompt. Or what went well today? Journaling helps you transition from thinking mode to resting mode. But another good thing about a piece of paper, and I think that there is a really good resource with this, is that with a piece of paper, I used to advise people, if you woke up in the middle of the night and you were like, oh, I can't forget blah, blah, blah. If you wake up with that thought, you're going to be hanging on to it, which is going to make it harder for you to go to sleep. So I would have people to have a notebook, and they could just write it down real fast and let it go. So it's the idea that if I write it down, I will have it in the morning, and I can let it go. And Nancy says it's all scribble in the AM, but her mind is settled, which is perfect. So we'll move on to our next slide. So out of the relaxation techniques, is there anyone that kind of spoke to you, something that you would like or be interested or open in trying? We're going to move on to our next slide, but I'm interested to know, is there anything that stuck out to you? I even think just talking about the progressive relaxation made me think about that again, that it might be time to do that before bed. So we also want to talk a little bit about limiting screen time. And it's because the blue light disrupts melatonin, which melatonin is the chemical that we naturally produce that makes us sleepy. So you may want to set a tech curfew 1 hour before bed. And you may want to consider, this is really hard, but sometimes taking notifications off, or setting notifications, or setting your phone somewhere where you're not going to see or hear. I usually set mine face down, and I set it on a table where I'm not going to hear if I get a text message or something come through, because every once in a while I've fallen asleep with my phone on my bed, and I always regret it because a text message will come through, a notification, and it will wake me up. So Kanita says she's interested in tense and release. Vera said progressive relaxation and journaling sounded good. And then Rhonda says gratitude journaling before bed. Absolutely. So thinking about that tech curfew, try reading, try stretching, or meditating instead, trying to do something a little bit different. Linda says, yes, turning off all notifications has helped me. And she likes the tension muscle release as well. we're going to move on, but inspiration to us all to limit some of our screen time before bed. And Kanita says, my phone has a night mode that turns down the blue light, which is great. And that's something worth, looking into as well. So we're going to talk about sleep aids and what to know. And again, I'm not a medical doctor, so I'm not giving medical advice here. I'm going to ask you to talk with your medical provider about anything, about all of these things. So melatonin, it may help you, it may not help you. I know when it gets darker earlier in the fall, my body naturally produces more melatonin. So I'm always tired so much earlier. But some people rely on melatonin to help with sleep. Talk with your doctor about it. Herbal teas, chamomile or valerian root might help you to feel relaxed. And those are, in the store, but, talk with your doctor about it. Prescription options, talking with your doctor. Usually prescriptions for sleep, can help people, but, I think it's important to think about all the other things, have we exhausted all the other things to sleep well on our own first? And with the prescription medicines, to use cautiously and short term generally, because our medical professionals, I'm going to sneeze at some point, our medical professionals don't want, excuse me, I knew it was going to happen, don't want us to, for our bodies to become addicted to or dependent on medications to sleep, because then our bodies won't fall into that natural rhythm. Jane says, a session on stretching or yoga, chair yoga would be beneficial. I agree. And actually, MS Views and News has a wonderful, they have had a moving program, and I believe that they've had a yoga program as well that is a chair yoga. So I highly recommend for you guys to look at MS Views and News and the programs that they're offering, because there would be those options with, I believe there's a Pilates, a yoga, and the yoga has chair options as well. So please look into that. So we're going to talk a little bit about cognitive behavioral therapy for insomnia. Now, not specialized in, but CBT can be very helpful for insomnia. And the reason why is that it will change our slide, Bill. It helps change the thoughts and behaviors that interfere with sleep. And it's highly effective, even more than sleep meds. And in many cases, it can be done with a therapist or online programs. So it's important to know if you're interested, hold on one second. Bill, if you can move the slide, please. That the CBT can address kind of thoughts and behaviors that sabotage our sleep. Even thoughts and behaviors like, oh, I'm not going to get enough sleep. I'm going to be so tired tomorrow, or there might be other thoughts that you have. CBT in general can help. We probably one day will do a whole program on cognitive behavioral therapy. But what I want to share from a resource perspective is that the VA has an app. And if you look for cognitive behavioral therapy for insomnia with from like on the App Store from the VA, there is a free app to help you with that. So I just wanted to share that. That was something I helped connect many people with during COVID. So when do you talk to your doctor? So we'll move forward to our next slide. So if your sleep, challenges persist, despite routine changes, it may be time to talk with your doctor about it. But please bring notes about your sleep, your habits, your symptoms, and what you've tried and what your barriers are and what you've been doing. There could be underlying issues like sleep apnea or medication side effects or even depression that could be impacting sleep. So it's important to talk with your doctor. If you are dealing with significant fatigue, despite having good sleep, it's important to talk to your doctor about that too. That's still my case. I can have really good sleep and still have fatigue. But talking to your doctor is important. So how do we personalize a sleep plan? So we'll move on to our next slide. There's no one size fits all here. Your plan should reflect your body, your lifestyle, and your MS symptoms. And think of it as a toolkit. Your evening routines, your relaxation tools, your environmental tweaks, and your realistic goals. And it's okay to start small. Even one consistent change can make a meaningful difference. So this is important. So just choose one thing that you'll do, one thing that you'll change, one small thing, and those make the biggest difference. So we're going to move 2 slides forward, Bill, and we're going to talk about you're having a sample sleep plan template. So your idea of this is to think, what is my bedtime goal? You know, for me, my goal usually is to be asleep around 10:30, although I want to be in my room usually by 9:30. What's my wind down activity? What is something that you can do to help wind you down? What is a sleep environment change that you may be able to make? Is it your, you know, is it to make sure that you have a cooler bedroom? Or I remember one time I had these curtains that just light was filtering in, and I eventually got curtains that just were light blocking, and that made such a big difference. And what relaxation technique will you use? So thinking about this as a guide, it's not a rule book, but you're making it your own. And then let's track progress. So moving on to the next slide. So tracking your small wins, not just perfect nights. Celebrate when you go to bed at a consistent time. If you've tried a relaxation technique. If you wake up feeling slightly more rested, notice that. Journals, there's apps, there's calendars, there's way that you can kind of track the accountability and awareness. And then we'll move on to the next slide. And then know that healing happens in connection. So share your goal with your friends. I remember when I decided to tweak my eating habit, I shared with a good friend of mine because I knew that I needed a little bit of support, and I shared with my husband too. And then know that you're not alone, that other people are working on this too. Other people without MS and people with MS too. So we'll move on to the next slide, and we'll, these are just some resources. Some of you have mentioned this. There's Calm, there's Insight Timer, there's Headspace. There's also an organization called the sleepfoundation.org. And there's a book. I'm going to leave this here for a couple of, I'm going to leave this here for a couple of minutes. So while I'm doing some of the takeaways, because you can take a picture with your telephone. So let's recap some of the core ideas here. So sleep is vital for our brain, for our mood, and for symptom management. Creating a routine that supports you and that's for you is important. Experiment with tools like breathing, journaling, or limiting screens. And then making sure you're talking to your doctor when it's needed. And don't go at it alone. You don't have to. Progress is possible with sleep, even with small steps. So we're going to thank Beatrice for their support again for tonight's program. And I'm also going to thank you for being here, for showing up for yourself and for your wellness. This is the classic slide that I end with, and I will use it forever, because I'm not saying goodbye. I'm saying I'll see you later. So I will see you next month. And until then, I hope that you guys have a well and happy as possible June. Stay cool and take care of yourselves, and know that you can make small changes.